Good afternoon, everyone, and happy Asthma Awareness Month. My name is Hannah Green. I'm the Senior Director for Nationwide Health Policy at the American Lung Association, and I'm excited that you can join us today to talk about asthma care coverage in Medicaid in 2024 and some exciting new work that is going on. Next slide, please. So just a little bit about our agenda for today. We're going to talk about our asthma guidelines-based care coverage project and our updated data on coverage of guidelines-based care for asthma in state Medicaid programs for 2024. Then we're going to have a presentation from the Healthy Schools campaign about some new policy developments around Medicaid and schools, which will and how those can help to improve access to asthma care coverage. Finally, we'll talk a little bit about other activities we have going on for Asthma Awareness Month here at the American Lung Association, and we'll have plenty of time at the end for questions and answers. So the Q&A is open in Teams, and so feel free to chat your questions in as they come up as we go along, and we'll make sure we have plenty of time for those at the end. So with that, I am going to turn it over to my colleague, Jacqueline Link, who is the specialist for nationwide health policy at the American Lung Association, to kick us off. Jacqueline?
Great. Thank you, Hannah. We're going to talk today about the Asthma Guidelines-Based Care Coverage Project and everything that we have found this year in our data collection cycle. So the purpose of the project is to increase an understanding of Medicaid coverage and barriers to access guidelines-based care across all 50 states, as well as DC and Puerto Rico. We want to identify gaps between what is known to be best practice in improving asthma outcomes and what is covered by state Medicaid programs. And we also hope to promote collaboration between diverse stakeholder groups to increase access to guidelines-based asthma care. And we are using the NAEPP guidelines, and this program is funded by CDC. And we are using the National Asthma Education and Prevention Programs guidelines that were updated in 2020 with the National Heart, Lung, and Blood Institute. And the reason this is so important is Medicaid covers 1 in 4 Americans, and 43% of the people that Medicaid covers are children. And nationally, 4 million children have asthma, and these rates are higher among the Medicaid population. So it's really important that the Medicaid programs are keeping up with the benchmarks for care. A couple of our other activities is last September, we published in the CDC Preventing Chronic Disease Journal. This was our findings from the first time we started collecting data up until our 2021 to 2022 findings of asthma care coverage. Overall, we found that there was significant improvement in most categories of coverage, though there are still definitely some areas where there could be more improvement. So feel free to check that out on the Preventing Chronic Disease website as well. So for this project, we track 8 components of coverage, and we track 7 barriers to care. And so every year we start our data collection by going through all publicly available documents in what is online and what plans have put forth already. Many states have multiple managed care plans that implement the Medicaid program, so we are looking at every single plan. So if a state just has a fee-for-service program, that's great. We're going to look at that. But if a state has 16 managed care plans, we are going to look at all 16 of those plans, like New York. And then more recently, we have been looking at, we have added some components of coverage. So we have these 8 here. Lung function testing is newer as of the 2020 updates from the NAEPP, as well as these 7 barriers to care that we've been looking at. And these are important to consider when a patient is accessing care. There's a reason that we're looking to see if these barriers are occurring when patients are trying to get asthma coverage. Even something simple like a prior authorization or a quantity limit can slow down a patient getting their care, or deter patients in general. Like copayments in the Medicaid population have been shown to cause patients to delay or defer care in general. So there's a reason we're looking at these barriers to care, and we're looking to see if they're being applied to any of these components of coverage that we care about. So here's an example of the data that you can find online. This is Delaware. This is showing our quick relief medications category, and then it gives you a breakdown of all of the components that we look for in quick relief medications. So for example, we've got albuterol in the inhaled form and the nebulized form, and levalbuterol in the inhaled form and nebulized form. So what we're looking for is to see that it's covered by all of the plans, in this case in Delaware. And then we're also looking to see what barriers are being applied to albuterol and levalbuterol. So this chart pretty extensively shows us that, for example, albuterol is covered, but there is no age limit, but there is a copay. We were not looking to see if there was a DME or eligibility criteria for this component, but there is not a prior authorization. There's not step therapy, but there is varying quantity limits, which means at least one plan in Delaware had a quantity limit for getting an albuterol inhaler. So that's just what you might see when you look at our website and see all of the data for all of these components and what was covered. But if you don't want to get into the too nitty-gritty, we also have a PDF that provides a more general overview of what is in your state and what is covered. So basically, you can go to your state's data page, but there's also a button that lets you generate this PDF. And it pretty clearly breaks down what's covered and which things have barriers. And this is an example, again, of Delaware and what you'll find in each state. In addition to all of our database resources, we also have a couple of other online resources that have been uploaded. We have an issue brief on the asthma core set, and this goes over the basics on CMS's updated quality measures on asthma. Back in August of 2023, CMS released a final rule on the asthma, or on the child core set brief. And that basically stated that states will be required to report all measures in the child core set, where this was previously optional for state programs. Now they would have to report everything. And the reason we care a lot about this is because this includes the asthma medication ratio, which measures medication compliance for patients with asthma. This rule also requires states to collect stratified data, which is really helpful for us to identify health disparities in the Medicaid population. So the reporting of the core set data can also serve as an incentive for states to make evidence-based improvements in access to asthma care that will improve their performance on these measures. So for example, if a state has data on the impact of a home asthma intervention on the asthma medication ratio, that will be helpful for building a case for Medicaid to cover home asthma interventions. We also have a resource uploaded on Medicaid in schools, but our guest later today is going to talk a lot more about that, so I won't go too into detail there. And without too much further ado, we can get into our actual findings from this year's data collection. Starting with quick relief medications, these are medications that are fast acting and able to immediately relieve asthma symptoms. And as I talked about with the example of what we see in the database, these are albuterol and levalbuterol in the inhaler and nebulized forms. And so we were looking to see if states were covering all 4 of those medications, and if so, what kind of barriers they were having. We found that 43 states covered all quick relief medications, while only 1 state was covering them without any barriers. And then the remaining 9 states had varying coverage, which means at least one plan in that state was not covering all 4 of those medications, or we couldn't confirm that they were covering all 4. As you can see, a lot of states are covering it, but with some barriers. And some of the more common barriers that we see in this case are going to be prior authorization and stepped therapy requirements with albuterol in order for patients to access levalbuterol. We also pretty frequently will see some quantity limits on the number of inhalers that patients can access. That being said, we actually were also collecting data on the quantity limits that were being implemented in these states. So on this chart, you can see that all of the states in purple were covering at least 2 inhalers for both types of medications per month for their patients. But in the states that are pink, only one of those medications was being covered at 2 inhalers per month. And in the states that are blue, the quantity limits were varying, but at least one of the plans was not covering at least 2 inhalers per month. And we want to see them covering at least 2 inhalers per month so that patients are able to properly regulate their asthma symptoms, especially if you have children who need to have an extra one at school or things like that. And finally, the states in white meant that we either couldn't find data on their quantity limits or they were not covering more than 1 inhaler per month for patients. Moving on to our controller medications, these are 21 medications that can be taken daily on a long-term basis to regulate your asthma symptoms. This includes long-acting beta antagonists, inhaled and systemic corticosteroids, and combined medications. So this is basically most asthma medications that you can think of outside of the quick relief medications that we just talked about. And coverage in this category is pretty similar to quick relief medications, but with slightly more states that had varying coverage. We found that 37 states covered controller medications with barriers, and 15 states had varying coverage of controller medications. Again, the state had to cover a whole 21 of those medications to be considered covered on this chart. Again, we also see some pretty frequent prior authorization or step therapy barriers for some of these medications. Especially, we see prior authorization pretty often for Xolair, which is a biologic medication that treats severe asthma. Our next category of coverage is coverage of medical devices. These are 3 specific devices we're looking at that assist patients with asthma. These are nebulizers, peak flow meters, and valve holding chambers. And like with the medications, state had to cover all 3 of those things to be counted as covered. So if a state wasn't covering one of those, then it was probably put under some coverage under the blue category. So we found that 41 states were covering all 3 devices and 10 states had varying coverage, and 1 state could not confirm coverage of medical devices. This is also the only category where we're looking for the durable medical equipment or DME barrier. And that is a barrier that means if something is covered as DME, then the patient may have to purchase it from a specialty DME provider instead of at their local pharmacy. And that can be a challenging process for patients. And again, it's something that may deter them from getting the care that they need. Now we're getting into the asthma services. The first one that we looked at is allergy testing for asthma triggers. This is part of the benchmark, and we do see some pretty good coverage of this. We have 44 states that were covering this, including 8 that were covering it without any barriers. We only had 8 states that had varying coverage of this service. Along with allergen testing, there's also allergen immunotherapy. And this is immunotherapy for patients who have confirmed with an allergy test that their asthma is triggered by certain allergens. And similar to coverage of allergy testing, we found that 43 states were covering allergen immunotherapy, including 9 states were covering it without any barriers, and 9 states that had varying coverage of this service. These two categories, allergy testing and allergy immunotherapy, are consistently the most covered category that we look at across all of our components of care. Moving into lung function testing, this is the newest category that was added in the 2020 updated benchmark. Lung function testing is made up of two services. It is spirometry, which is measuring lung capacity, and fractured exhaled nitrous oxide, or FeNO testing, which measures airway inflammation. FeNO testing is newer to the NAEPP guidelines. So in a lot of cases where we see states that have varying coverage, it's often because the state was covering spirometry, but not necessarily covering FeNO testing. So that being said, we had 30 states that were fully covering lung function testing. 8 states were covering them without barriers, and 22 states had varying coverage of lung function testing. Of course, as we move into home visits, this is where we see the largest room for improvement for guidelines-based asthma care. So an asthma home visit is a very specific type of visit that we're looking for Medicaid programs to cover. We are looking for a minor intensity intervention home visit. This means the provider is coming to the patient's home and assessing it for asthma triggers like pests or dust, and this is covered over the course of at least 2 visits. We do see a lot of plans that offer case management or home respiratory therapy for patients with asthma, and those are not the same. They're great, but they're not the same as a home visit, which is what we were looking for in this case. So several states also had partial coverage of this service. So we have 10 states that had varying coverage. That means that at least one plan in that state was covering this type of home visit, but that it wasn't available to every patient with Medicaid in that state. Only the patients within the plan that was covering that. And we did find that 3 states were fully covering home visits. And our last component is coverage for self-management education. Now, this is education that is provided directly to patients on how to monitor and manage their asthma. This does not include case management or disease management programs, even though, again, those are great. We're looking for when a provider is directly educating a patient on how to manage their asthma, such as how to use an inhaler or nebulizer, how to identify and avoid environmental triggers, how to understand the role of their medications, or use an asthma action plan, or all types of self-management education we're looking for. In this, we found that there were 41 states with full coverage and 8 states without any barriers, and 11 states that had varying coverage of this service. So what does it all mean? So we are lucky that we've been tracking this for several years now, and we can compare how things have improved over time. So in this chart, each component of asthma-based care has a color on this map. And you can see that there's a general upwards trend over the last 5 years of coverage of a state. So a state had to be fully covering it for us to count it on this chart. And the only category where we don't see any improvement is in home visits. So obviously that's a place where we want to focus our efforts in the future. An easier way to visualize this type of improvement is with this little GIF. Basically, the darker a state color is, that means that's how many categories, the more categories it was covering. So as you can see over the years from 2017 to 2020 to 2024, more and more states are covering more and more categories. So this is a good trend we're seeing. It's very encouraging for the asthma community and for this project. So finally, some key conclusions. When we're identifying gaps in coverage, the area where we see the most need for improvement continues to be asthma home visits. However, every state has an area where they can improve. So again, we encourage you to check out lung.org and see your own state's database and where your state might have some room for improvement in asthma coverage. Ensuring that states are fully covering these benchmarks and removing barriers is the best way to increase the positive health outcomes for asthma patients. Like I said, even small copays or administrative barriers can deter Medicaid patients from getting care, and we don't want to see that. Another thing we found while doing this data collection is that it's important that state programs have this information readily available, both on their websites or in their policies that are defining what coverage is and what the barriers are so that patients and providers can easily understand what processes they're going to have to go through in order to get the care that they need. But overall, coverage has been improving since we started collecting back in 2016 to 2017. So we're looking forward to further improvement, and we will continue to be tracking this coverage as we go along. And with that, I will hand things back over to my colleague Hannah so she could introduce the next guest.
Thanks, Jacqueline. And now that we've gotten a really great look at sort of the landscape of Medicaid coverage for guidelines-based asthma care, I want to really excited to introduce our next speaker to talk about some recent changes in opportunities for schools to work with Medicaid, and a really exciting partnerships that could happen that could help to ultimately improve access to guidelines-based asthma care through Medicaid in schools, for some of the kids served by the Medicaid program. So I'm excited to introduce Jessie Mandel. She's the National Program Director for the Healthy Schools Campaign, and she's going to walk us through some of these recent developments. So Jessie, let me turn it over to you.
Thank you so much, Hannah. And I just want to say at the onset, it is May 2nd. If anybody was confused about my slide saying May 3rd, I'm a day early on it, just like to be ahead of the game. But thank you so much. I'm really excited to be here. Hannah, thanks for the introduction. I'm looking forward to talking more about the school-based Medicaid program, and as Hannah said, thinking more about ways that school-based Medicaid can support more access to asthma care and asthma services in schools. So if we go to the next slide, I'll start with just a little bit of information about Healthy Schools Campaign for those of you that might not be familiar with us. We're a national organization. We work at the intersection of education, health, and equity. We are a national organization, but we're based in Chicago and draw on our work in Chicago public schools as well. And our priority issues also include green schoolyards, clean air in schools, and then, of course, advocating for comprehensive school health services. And as I'll be talking about today, advocating for how school Medicaid can be a really key way to sustaining sufficient funding for school health services. So why invest in school health services? I know that many of you are very familiar with this, and the importance of school health services overall. But I, always want to just stress why we care, why we all continue to care about school health services. They're so critical to advancing equity, to improving access to health and wellness, and reducing those disparities and barriers to care that we know so many students continue to face. School-based health services allow for the early identification and intervention of health issues. And of course, they're linked to better physical, mental, and behavioral health and academic outcomes, both in the short and the long term. So that's why we all continue to work on school-based health services. But of course, there are different models for delivering health services in schools. Some schools partner with community-based providers, or host mobile vans, and these are where outside providers, including Medicaid providers, come in and offer services. Some schools operate a school-based health center, which is located in or near a school. But when we talk about the school Medicaid program, we're really focused on providers who are employed by or contracted by the district to provide or deliver services in a school setting. So your school psychologists, your school nurses, school counselors. And now, of course, all models of delivering services in a school setting are important and can work together. But my focus today will be on school employed providers, and this is where Medicaid plays an especially unique role. So to back up for just a moment, looking at the Medicaid program overall, and I know many of you are familiar with it, and Jacqueline really laid out just the role that Medicaid plays together with its sister program, the Children's Health Insurance Program, in covering students and guaranteeing children comprehensive coverage for all medically necessary services. But a key feature of the Medicaid program is that it's a shared state and federal partnership, and the total cost of the program is split between the federal government and states. And states have the flexibility to design their Medicaid program, as we've seen, and cover different services or not cover certain services. And then, of course, CMS signs off on the program. And as we've also been discussing, Medicaid programs can be changed, but they are governed by the state plan, which is a written document approved by CMS. And then changes to a state's Medicaid program are made through state plan amendments, referred to as a SPA. And we'll be discussing this a little bit later in my presentation. So, over the past 30 years, Medicaid has paid for eligible school health services included in students' IEP, or Individualized Education Program, or IFSP, an Individualized Family Service Plan. And while Medicaid spending on school-based health services represents around 1% of the total Medicaid program or Medicaid spending, it's a significant source of funding for schools. But historically, Medicaid would only reimburse schools for services provided to a limited number of Medicaid enrolled students, those with IEPs. And then in 2014, CMS made a policy clarification that schools can be reimbursed for services provided to all Medicaid enrolled students. And this is sometimes referred to as the free care policy reversal. So today, Medicaid can pay for school-based health services if the student is enrolled in Medicaid. Services are delivered by a qualified provider. States have appropriate billing and documentation and oversight mechanisms in place, and this, of course, can be no small feat, as many of you know. And as we've been talking about today, the services provided are covered by the state, and that's also very important. But taking a step back for just a moment, if we go to the next slide, it's important just to think that, remember that at its core, expanding school-based Medicaid can mean an increase in the amount of federal funding to support school-based health. And it's potentially a big and sustainable new source of revenue to help schools stretch their health budget further. And more than that, that's an opportunity for state and education policymakers to think more holistically about meeting student need, the types of services, the workforce needed to help improve student health outcomes. So this slide, oops, sorry, it looks a little bit funky on my screen, but you get the what it shows is just a sampling of the types of providers and services eligible for reimbursement. And recent federal guidance makes clear that schools can cover a broad and comprehensive range of services, such as asthma self-management education, and a wide array of school health provider types. And so this really is only a sampling of the types of providers and the types of services eligible. But it's up to states to decide to expand their school Medicaid program. And several different stakeholders are likely to be involved in this choice. Of course, the state Medicaid department, the state education agency, and others. And once a state has decided to expand its school-based Medicaid program, it also must look at its existing state plan to see what needs to be done and if an amendment or spot is needed. But what's important to know in our sort of new school Medicaid moment that I'll be discussing, new guidance from CMS suggests that all states will need to update their school Medicaid program to conform with new requirements. And so this can actually be a really pivotal moment for states to expand their program. So this school Medicaid moment that we're in, well, in the last few years, we've seen a significant increase in federal support and investments around school health services and the role that school Medicaid can play in advancing and sustaining services through ESSER and COVID relief dollars. But the biggest game changer for school Medicaid were some key provisions in the Bipartisan Safer Communities Act, which passed in June of 2022. And the act stipulated that CMS makes some much needed updates and clarifications to its school Medicaid guidance for states. It also called on CMS to establish a technical assistance center and to issue grants to states to expand or strengthen their school Medicaid program. And those grants were the awards have not been made yet, but the grants were the NOFA went out earlier this year. So this really has been a game-changing moment for the school Medicaid program. Now, looking at the new guidance that I've referenced and mentioned just a little bit closer, this guidance really gives us a roadmap for thinking about the school Medicaid program going forward. It encourages all states to reduce the program's administrative burden through new flexibilities and options in the guidance. It encourages states to expand school Medicaid to all students beyond those covered by an IEP or IFSP, for states to cover all medically necessary services or all EPSDT services, cover a wide array of healthcare providers, and to work towards greater collaboration and communication across all state agencies when implementing their school Medicaid programs. And the administration is providing active support to states to take action and to really maximize their school Medicaid program to cover as many students and services as they can. So now let's look at the activity happening in states. This map shows which states have taken action to expand their school Medicaid program. And you can see here, you don't have to count, these are 25 states have taken action. But it's also important to note that even if a state is white color, there is likely activity churning just below the surface, and many who are really working in that state to expand the program. And this is progress that we do track regularly. We have a state activity tracker. It's also important to note that in our analysis, we found that even those green states all have work to do. Some states have only partially expanded their programs, so they might not yet cover all eligible services or all eligible students. And so all states have work to do to really fully implement and maximize their school Medicaid program. But this map also demonstrates how many states are thinking about new ways to sustain investments in school health services and really work at the intersection of health and education. So, oh, that's great. So now I just want to look briefly at two states. While many states are just getting started in their program adoption, several early adopters are showing what's possible. And so I'm just going to highlight briefly two early adopter states, Michigan and Colorado. In Michigan, they submitted a state plan to cover more services for more students and add additional Medicaid eligible providers in schools, such as school psychologists. And these changes to their state plan have allowed Michigan to draw down an estimated $20 million in new federal funding for their school-based Medicaid program. Colorado is another great example, and they put in some really strong training and support for their school Medicaid program at the onset. And they've estimated that expansion will result in a 30% revenue increase over the IEP program. So if you're wondering where your state is at and what's happening in your state, I want to encourage you all to check out our state activity tracker on our website. It's a great interactive map to find out what's happening in your state, what the landscape is, and what's currently covered. And it can be a really great starting point for learning about the services and the provider types covered. So moving forward, this is such a key moment for school Medicaid and school-based health services, and it's not showing any sign of slowing down. And we really have an opportunity now then to provide more guidelines-based asthma care to more students, But we have to keep this momentum going. So we need to ensure that school Medicaid reimbursement goes toward health services, that states maximize the program by covering all eligible services to all eligible students, and that we increase the collaboration and coordination across agencies to build the most effective programs. And finally, with more health systems and delivery models providing more care and more asthma care, we need to think holistically about how these different models and funding streams and systems are working together for our students so we can coordinate that care and ensure that all kids are staying healthy, learning, and thriving. So I just want to share these resources, and well, I know they'll be shared to you afterwards. These include a look at the status of different Medicaid expansion, school Medicaid expansions by each state. And we have a brief too on how to document medical necessity in schools through plans of care. Plans of care often used are what's used to document care outside of an IEP or IFSP in the school setting. And then we have this guide to expanding Medicaid funded school health services. It's really a great starting guide, a real 101 to help you learn more about the school-based Medicaid program. And of course, we have many more resources beyond that. So thank you so much to Hannah and Jacqueline and to this great event. I've been so thrilled to be able to join it and looking forward to staying on for questions.
Thank you, Jesse. And yes, as a reminder, if you have any questions for Jesse or questions about anything else Jacqueline covered, I know we have already seen a couple come in the chat, in the Q&A, excuse me, but feel free to type those in and we will turn to those in just a moment. But before we do that, we're going to wrap up with a few updates about other Asthma Awareness Month activities at the American Lung Association. So let me turn it over to my colleague, Barbara Kaplan, who's our Director of Nationwide Asthma Programs.
So here are 5 ways that you can stay informed about asthma and join our efforts. You can learn more about asthma and excessive heat at lung.org/asthma-awareness. Learn more about asthma by visiting lung.org asthma and take asthma basics. Also, improve your skills in delivering asthma guidelines-based care by participating in our upcoming Asthma Educator Institute. We have a virtual event happening June 4th through the 9th. So you can register by clicking on that link available on your screen. We also are encouraging people with asthma or caregivers to join the American Lung Association's Patient and Caregiver Network to get support, education, and connect with others. And lastly, you can always support asthma research by making a donation to the American Lung Association. All right, and then for our next slide, I have lots of learning opportunities to share with you. Every year, as we recognize Asthma Awareness Month, we provide learning opportunities for patients, caregivers, healthcare professionals, and the general public. So a couple to highlight for you, coming up on May 7th and May 15th, we have 2 Asthma Basics workshops. So these are live events. You can click on those links to register, and we welcome you to share those with your constituents in your community. On May 9th, we have a webinar on the role of anxiety and asthma self-management. And this is part of a webinar series. So May 16th, we follow up with a webinar on smart treatment for asthma management. And May 30th, the impact of climate change on asthma. So we hope to see you at these upcoming events. Lastly, I will mention Lungcast. You can hear Dr. Rizzo. He's going to be highlighting the topic of asthma during Asthma Awareness Month. So listen in, you can click on that link and access our Lungcast. So for questions about these learning opportunities, more resources, or any other ways to get involved, you can visit us at lung.org asthma-awareness. And with that, I'll kick it back over to you, Hannah.
Yes, awesome. And if all our presenters can rejoin us, we will turn to Q&A. So we've gotten a few questions in the chat already, which is great. And so I might combine a couple of them. So, and Jesse, maybe I'll start with you. There are a couple of questions about kind of the connection between what you've been talking about and specific services for asthma. So, for example, do you think that the expansion of school-based Medicaid that you've talked about could help to cover stock asthma medication for children enrolled in Medicaid, asthma self-management education, and then are there any specific states that you know have been working on asthma specifically as part of their work on this issue?
Thanks. Yeah, so I kind of going in reverse order. I think states that are, I don't know states that are specifically working on asthma care so much as states that are trying to um, make sure that everything is covered under their school-based in their school-based Medicaid program. And by that I mean that they're taking action to include the all medically necessary services as the way to expand their school-based Medicaid program, and rather than just limiting it to certain services or to certain students, and that they're also expanding to all Medicaid eligible students in schools. And so I think that's really the best avenue to ensure that certain services can be offered and schools can receive reimbursement for those services, and that if there is asthma management education, if that is provided by a school nurse, for example, would be eligible for reimbursement if it's covered in the state plan. And so I think that's kind of the key. But I think the way to do sort of make sure that you're maximizing what is reimbursable is by making sure that it's a really wide expansion, if that makes sense. And there was the first question about another type of a medication, or that might be, what was the first question?
I mentioned stock albuterol
Okay,
medications, and then yeah, you already talked about self-management education.
yeah,
So I think we've covered it. Yeah,
yeah. And I think it's really about the provider and the service that are
yeah,
in the school setting.
awesome. Thank you. A question for Jacqueline. If folks want to kind of do a deeper dive into their state's data and maybe talk to someone to learn more, how should they do that?
Yes, you can reach out to us at asthmacare@lung.org. We'd be happy to do a deeper dive on your state's coverage and help you identify where states need have room for improvement.
Awesome. And then question for you, Barbara. I think I know the answer to this, but some of the other webcasts that you just went through for Asthma Awareness Month, will those be recorded and available on our website?
Yes, we should be able to record those and send some links out. If you do register for those events, that's a great way to make sure that you get access to the recordings. So
Yeah, awesome. Thanks. We've got a couple questions about some like specific like what's covered in specific states. One is about smart therapy and whether that is covered in a specific state. That data is not on our website, but if you have questions about kind of exact quantity limits for the medications that are included in smart therapy, and whether or not your state has kind of updated to theirs uh, quantity limits to make sure that that's accessible to patients with asthma. We did an issue brief on that last year that's on our website that has kind of a high level snapshot of where states were. But if you reach out to us at asthmacare@lung.org, we're happy to, do a deeper dive and kind of chat with you about some of those like more granular specific details. But that's a great question. Um, Another question for you, Jesse. What are some of the implementation challenges that are kind of most common that states have been struggling with as they attempt to expand access to Medicaid in schools?
Yeah, I guess a few ways to answer that question. I think um, to get started, I think what's really important is bringing together the Medicaid, the state education, and the school districts. And I guess no matter what, that's really key to building an effective state school-based Medicaid program is having all three and other stakeholders like public health, behavioral health, but having your state education, your Medicaid, and your school districts together and talking about the program as you're deciding to expand or then implementing your expansion are really important. But of course, we know that this can also be a challenge because not all of there might not be sort of that relationship already in place, that communication or coordination mechanisms already in place. And so that can be a challenge, but it's really key to trying to build those relationships out. And something we really lift up and try and support states in doing at Healthy Schools campaign is to build that relationship between the three entities. And so I think that piece is really important to ensuring that, you know, that you're getting started and that you're continuing to have a successful program. I think another component is making sure that that the school Medicaid, all states, and I refer to those green states that have already expanded, even states that have taken comprehensive action, that have fully expanded to all the services, all the providers. Even those states have work to do to bring on more LEAs, more school districts, and that continues to be a really important part of the program overall, is providing ongoing support, ongoing training to school districts, and to make sure that school districts are able to participate in the program. And that's really where that, again, goes back to that relationship between the three entities, but bringing on more school districts is a really important part of maintaining and strengthening the program. I could talk forever, but I'll stop there. That's a great question.
Muted, sorry. No, that's super helpful. I think that's a great start. A couple of other questions I will just answer really briefly. There are a couple of questions in the chat about like changes in GINA guidelines and how those might impact this project. We use, as Jacqueline mentioned, the NAEPP guidelines to ground our work on asthma care coverage. And so changes in those are really what impact what we track. We do have a stakeholder group of advisors that helped us kind of create that original benchmark document to translate those guidelines into what we track. And we do reconvene that group every few years to make sure we're staying kind of up on the latest guidelines and what is happening there. But just kind of wanted to clarify what we use for this project. And then a couple of questions about just general information about asthma. And so lung.org/asthma is a great place to start. And if you want additional information, as Jacqueline said, feel free to reach out to asthmacare@lung.org. And if you have more specific questions, we're happy to help with that. Speaker requests I've also seen in the chat. Asthmacare@lung.org is a great place to go if you have additional needs, and we're happy to work with you to see what we can do. I think that's a good roundup. I think I've hit most of them, hopefully, at least through combining questions. So I'll do a last call for questions. If not, Jacqueline, do you want to reshare the last slide? Because one thing that we would love your help with in our last couple of minutes is completing a very quick survey of today's webcast so we can continue to improve the work that we do. So I think if we go to the next slide, we should have, yep, there's a QR code right there. And I will also take the link to the survey, and I will publish it in the Q&A. So that should hopefully go out to everyone if it's easier for you to click that. And if you could just take 2 minutes when we're done to fill out that survey, we would really appreciate it. I don't see any more questions coming in. So I think with that, we'll probably wrap up. I want to just thank all of our speakers for sharing a ton of great information today. I learned a lot. I hope you all did too. And as I said, if you have follow-up questions after today's webcast, feel free to reach out, and we're happy to work with you on a more one-on-one basis to get those answered. So last call to please fill out the survey. We'd really appreciate your help with that. And with that, I will wish you all a happy Asthma Awareness Month, and have a good rest of your day. Thanks, everyone.